Paid sick leave. Some of us take it for granted, but nearly 200,000 Seattle workers don't have it, and many of those people say it forces them to work when they're sick.
If you work 5 days a week and you call out sick one day and you don't get paid, that's a fifth of your income. That's pretty significant.
I've been involved in conducting research on the health impacts of paid sick days since 2006 and have co-authored 2 comprehensive health impact assessments of the paid sick days legislation. Almost all the data and evidence I've reviewed is consistent with the premise that a requirement for paid sick days would protect the health of all Americans.
I'm sick, but I was feeling better the next day, so I came back to work, and then I was told it was an unexcused absence because it wasn't scheduled. Well, how do you schedule a sick time? How do you schedule an emergency?
I get sick with it.
First, I'm afraid, if I call in sick, they're gonna intimidate me and say why you were sick. And I'm afraid if I'm really, really sick, they're also gonna cut back my hours.
If you're ill, then you should be able to take the time off without any repercussions.
Marilyn Watkins with the Economic Opportunities Institute says
190,000 people working here do not get any paid sick leave. And unfortunately, it's oftentimes the people that are directly handling our food that have a lot of public contact in restaurants and retail, even to some extent in healthcare.
And cities like San Francisco, Milwaukee, and Washington, D.C. have already implemented a sick pay policy. Of course, many here hoping that Seattle will follow suit.
If there is a way that the city council or some people can let her have a sick pay so that I can be there and take care of my daughter, that's very good.
What do you think? Should paid sick leave be extended to all workers?
We shouldn't have to decide between making money to care for our families or being healthy enough to care for our families.